And once we have that, it's like nothing else matters, right? We see this all the time with clients. They'll come in, they'll be trying for 8 months, 10 months, a year, however long, and they know they have PCOS, or they know they have endometriosis, or they know they've had a diagnosis, a clinical diagnosis given by their care team currently. Then because of that, their care teams basically turned a blind eye to their partner saying, well, it's definitely not a you issue because we know this person's not ovulating, or we know that this is a roadblock. And that also is doing couples such a huge disservice. Why? Because 33% of infertility cases are both male and female factor combined. A third of cases is male and a third of cases is female. So when we're looking at female, we're looking at over half. And when we're looking at male, we're looking at over half if we're kind of dividing it out like that. So if we're ignoring sperm because of a female factor diagnosis, we are still potentially missing out on another roadblock. We're potentially missing out on a red flag. We're potentially missing out on actually optimizing that fertility potential. So if that is a part of your journey, again, we're going to advocate, right? I understand that we are aware that XYZ is likely part of our story, but we haven't actually tested my partner yet. So do you think we could run some testing there just to make sure there's not something else we're missing, right? If we're coming at it from a very just like, I acknowledge, the flow of things, but also you get to decide when you want these answers. You do not have to wait. And that brings me to my third point of, if your current care team is truly, truly not willing to run a basic semen analysis, then there are some at-home options. I would love you to go and have drop off a clinical sample with a lab that is analyzed right then and there. I do think that we're going to get better results from that type of testing. However, in this line of work, that's not always accessible to us, unfortunately. Myself, as a naturopathic doctor here in Ontario, I can order a semen analysis for Ontario clients. However, there are very few labs that will actually take a sample dropped off from my requisition, meaning there's a roadblock to location. You have to have it analyzed within an hour. So there's not a lot of opportunity or options for myself to be able to order them for clients. And we have to use other means. But then if you're running into that roadblock with your current care team, know that there are at-home options. We personally love recommending Fellow because they're one of the few options that also looks at morphology. So we want to see concentration, motility, morphology at the very least. If you've done an at-home option before and the numbers are really bad, my kind of consensus and general rule of thumb is, let's not panic yet. If the at-home options are really bad, if anything, this is something to take to your care team and say, we did this on our own. The numbers are not great. We would love to confirm them with a clinical sample. And hopefully they'll be more willing to dig deeper with you, because it's not a perfect system, right? Flash freezing and shipping and thawing, and there's more room for error in those situations. I'm not saying that the at-home options aren't valid. I'm just saying there's definitely more room for error. So if the numbers are terrible, before we totally panic, let's confirm that with a clinical sample and just see what those numbers say as well. I have seen discrepancies when we compare those two. So something to think about, okay?